right.
Yeah.
So I've had a chance to look at a lot of the stuff that you have been sending in the WhatsApp group, uh,
Yeah.
some of the stuff that you guys have been doing in Mathare Social Justice Centre
Yes.
with respect to the response to COVID. But I thought it might be worthwhile just to do a little interview here to get your reflections on things, because there's a lot of discussion which is very centered on what's happening in this country, what's happening in the European countries, what's happening in the United States, which it's terrible here. But speculation about the situation in the African context. And so, because I know you've been doing interesting stuff, just to give you a sense, just to get a sense of what the feel is in Mathare, what people are up to in Mathare, and how they're confronting the situation.
Yeah, it's very important as you know, the COVID-19 crisis came during even when the time we had a major problem of the economy. It found ourselves that the economy was down, there was a major challenges, and employment was high. As you know, you have visited Mathare and many spaces in Nairobi. It has been very, very difficult. Our economy is an informal economy. So when you talk about lockdown, and you have people who are living from hands to mouth, it's very, very difficult. So we are almost 4 weeks of a curfew. It has not been sustainable. Even the Kenyatta, the president, spoke that the other day, and he said we can't remain permanent in lockdown. It's saying like almost a million people from informal economy have lost their jobs, especially the small restaurants, mamambogas, people who are struggling to feed themselves, the small kiosk. They don't have a job now, and it has been very difficult, especially in Mathare. Just today, our center is distributing some food to our members. Just a small team of our members. We did a small fundraising. Then we are doing a small package of maize meal and maize meal, rice, and small things and sanitizer that can help our members to survive. So that's how we've been struggling here and here through self-help, people making their own mask. But it has been very, very difficult. The political class tried to distribute food in Mathare, but it was chaotic because majority of the people, they were starving, so they could not even wait for the line. They just came and grabbed everything from the lorry. So it has been very difficult. Also, the skyrocketing crime is getting high, people breaking houses. So sexual and gender-based violence is huge. Women are very heavy burden on this crisis. So it has been very difficult. But all in all, we survive. Thanks that the level of death has not been very high, but I don't think, maybe it's because our healthcare system infrastructure is not there for testing and treatment. So there are lots of deaths that have been happening, especially for pneumonia, but they are not reported as a cases of COVID-19. So you can see that kind of a situation. I have lost number of friends, close friends also. And my colleague Juliet Wanjera also lost a father in Mathare, pneumonia, and many others. But you see, because of lack of a strong infrastructure of healthcare, some of these cases it's not possible to detect. Yeah, but all in all, we are trying as a social justice centers. We have really done a lot of work, and especially, in fact, we have not slept through this crisis. We've been documenting cases of human rights violations. As you know, the Kenya is still a neo-colonial state, very strong instrument of violence. So instead of providing people with the basics, like in Mathare, they didn't bring water or basics. What they brought is a police and triad squad to come and contain people at houses during the night, the curfew that start from 7 p.m. to early in the morning, 5 a.m. And you know, majority of this informal economy also is it is 24 hours. Some people work during the day, and some people work during the night. And some of these restaurants, pub, matatu industry, all these people, when you close them during the night, it's not possible for them to survive. So police has been very violent. attacking people, detaining people. It is this opportunity for extortion. So extortion has been very widespread, but we have not slept. We've been documenting a lot, and some of our voices have been heard by the government and mainstream human rights organization. So we also did a small partnership with the UN Human Rights Office here in Kenya to try and document this kind of human rights violations. And using those agencies, those kind of information reaches the people with the authority. And sometimes we have seen them saying that they will change on the way they are monitoring the curfew. But as you know, it's just empty promises. When people are starving, they don't have clean water, healthcare. It's very, very difficult. But all in all,
yeah. So could you tell a little bit about the what you guys in the Mathare Social Justice Center have been doing, the initiatives, the consciousness raising initiatives, different kinds of initiatives in the neighborhood in response to COVID, and also maybe just say a few things about what people's attitudes towards COVID are, to what extent people are afraid, to what extent, et cetera.
it's very important question, Jeff. What we are doing. First of all, is we're doing political education using graffiti, telling people that this virus, this coronavirus is real and it is there, and we have to be very careful. We also people doing some artists developing a mask, like developing masks like this one for this self-made by people so that they can use them. Not only waiting for the government to provide them. So also we are making sure that we have some water points within Mathare. We got some donation of tanks, so we put out there for hand washing, and also using it as a space to educate people about the crisis of coronavirus. Also, we are doing campaign on right to water. We did a monitoring and shared with people the challenges people get facing in accessing water. And also we did a petition to the government and demanded that the government need to provide people with water. So that's more small initiative that we are doing. But what more major is the public education, using graffiti, drawing in different spaces in informal settlement in Mathare, and showing the people this is a crisis, and linking it with the historical problem of poverty, because the people who are hardest hit is the people who are poor. So we're also doing this and linking it with the history of oppression, human rights violations. Also, we are visiting different biocenters. These are spaces where they are created spaces for public toilets. Then we're using those spaces also to educate people, putting their graffiti and telling people that they need to think about their lives, because the government majority is not concerned. So that's what we are doing, and also supporting our members and fundraising here and there to support our members to survive. But it's very difficult because our population of Mathare, it need a full-fledged government to come in and sort out the problem. We're also having challenges because the government is using these military people to come and try to build the roads, bring drill borehole this time, and there's a major problem with the sewage, so it's not working. So that's what we are trying. What we are trying to do, all in all, is a political process. Is using also this opportunity to remind people this is a problem with the economy, the way our issue of land is organizing, issue of housing, issue of education. Is all this is trying to tell people and educate people as a part of also building the movement of social justice within informal settlement, at using the crisis to articulate and doing the small help that we can manage, especially for self-help, but not majorly. I can tell you, not majorly. It's not possible for a community-based organization to be able to shoulder the work of a government, especially for water and food and healthcare. It's very, very difficult. The only thing we can do is to articulate as this crisis as an issue of social injustice. And monitoring human rights violation. That we have done very well. We have documented all cases of police brutality, illegal detentions, also extrajudicial killing that happened when the police were enforcing the curfew. That we have done, and made sure that these issues have come from the grassroots and put them in a national level. That we have articulated.
Now, is there a presence of community-based health workers? Are they doing stuff in terms of trying to test, or what is the presence of the sort of healthcare system, be it community-based, be it state-based, in Mathare? What kind of efforts have been taking place? Do you hear me?
You're breaking, Jeff, but I can hear you. So you see, we have a network of community health workers, but they're not really professional. They are health workers who report cases that are happening. Yesterday and the other day, the government health workers came to Mathare at St. Teresa. They were doing the mass testing. So people are asked to ask people to come out and go being tested. But this is the government. But our community health workers, what they have been involved much is contacting the government, informing ambulances. Majority in Mathare, the people who are doing this is the MSF, which is based close to where our community center is. So we've been having their contact and the number and informing them about the different cases. But this has not been really respond about COVID. It has been also other health issues that are happening, accident, fire, and also victim of police brutality. That's what we have been using. But in terms of a community health worker, networks are there and monitors, but majorly they have not been involved much in COVID, especially because this COVID also there's a lot of fear because people don't have protective gear. So it has been very difficult. And also people don't sometimes, although we have a lot of material we've been sharing for civic education, our posters around, sticking them everywhere and showing people how to do hand washing and us and detecting the infectious symptoms that we've been doing. But majorly monitoring and trying to see the cases that are within the community, that one has not happened because also people fear, and maybe sometimes people they are not able to differentiate between different diseases that are affecting people at this time. Also, this time people are fearing to go to hospital because also the other thing what government did is close. The doctors and nurses, they close the hospitals, and you cannot be allowed even to go and see your patient at the hospital. So there's a lot of fear around healthcare institutions. So you find many people, even if they are sick, they just sit at home and not going even to hospital. Because the other thing is that before you get into the hospital, there are a lot of security screening. And this security screening is not healthcare related. It's just a police, security guards, all that kind of thing. And they don't have even knowledge or equipment to test this thing. So this has also disoriented the community health workers because there is too heavy securitization of this problem. So you find people are getting fear. Instead of coming out to volunteer, people are getting fear. And also the government came out with saying that essential services, you find before you prove to the police that you are a community health worker, and I know majority of the community health worker in informal settlement, they don't have a certificate or identification. So, and Mathare is bordering Isli, you know Isli. So it's bordering
Eastleigh
Isli.
is a hot spot, no?
Yeah, and it has already been a lockdown and a curfew. But it's not lockdown. The ministry speak about lockdown in their mind, geography in their mind, but they don't know in the ground. These places there's no boundary. People are connected. It's not like maybe developed like London or wherever, where the streets and housing are orderly maybe. So these places are intertwined. You can't say this is a boundary between Islin and Mathare. So there are different routes that connect to each other, and life is the same for the people. So the police have found an opportunity to put roadblock there for extortion.
Mm,
So community health workers are fighting a lot of problem because they don't have those identification card, and they as essential service. So to pass through those roadblocks is very difficult because the problem, the system has put this as a security problem.
mm,
So it has militarized the problem and put police. So now the police are poorly trained on issue of healthcare. They don't have even equipment to test people about their temperature or maybe to detect some of these symptoms. So the problem is this lockdown is just the police state.
mm.
So this has disoriented a lot of people, and especially those people who would want to come out and volunteer. Even if the middle class who would want to come and bring food in Mathare, and some of them, they're not coming because they feel a lot of harassment. And even as we've been trying to get them to our space there, it's very difficult because they feel a lot of harassment. And the system also has a way of, they're using this opportunity, especially the grassroots administration, provincial administrations, to enrich themselves using food and all this to distribute to their friends and people who don't criticize them or ask them for accountability. So
Mm.
that's a major problem. It's a whole social crisis, and also compounded with the big problem of unemployment that will
Yeah.
hit us. Yeah.
Yeah. So what's your sense moving forward, how things are likely to develop in the next weeks and months?
So they say our
What are the main challenges that seem to be mounting, so to speak?
the main challenge is that the people cannot continue staying indoor more because there's a major violence, domestic violence starting is widely spread. Criminality is also getting rising. People and already people are breaking up the curfew. You find people are going back now to the city. People are going back to their spaces of the work. So the major challenge may be the coronavirus will spike, and it will become very overwhelming, and our hospital infrastructure will not be able to manage them. And then from there we'll have a catastrophe, big problem. And also we have maybe those people who have, especially the vulnerable people, will get affected because now it will be a major interaction, and after the people go to normalized situation how they used to work a daily basis, and with this challenge, and now you have it will be a major problem because we have a government that is very weak in terms of social institutions, so it will not be able to support people.
Mm,
Hopefully, this crisis also give us a spark for the people to demand a life of dignity, and that's how, as a social justice movement, we are focusing on that, saying this will be a long-term and protracted struggle because this health crisis will continue with us for a long time, and it is connected with other complex problem of social issue, food.
mm, mm.
As you know, majority of people, we have the crisis with rain. The coronavirus crisis came when it was a planting season. So majority of the peasant and farmer did not manage to do planting, get fertilizer, get everything that is needed to prepare the land. So there will be also a major food crisis. So as we move forward, we have an economy that is going down, food crisis. So there will be a lot of social upheavals, but it's how we are organized as a grassroots social movement, also partnering with other formations, see whether we can bring together an alternative voice that can organize this anger and hopelessness to
Yeah.
a positive outcome of
Yeah.
demand for democracy and social justice.
So what are the
Yeah,
kinds of
Jeff.
things, yeah, what are the kinds of things that, to an audience of people who are interested in social justice, what are the kinds of messages that, in terms of solidarity, that we can, what can solidarity look like in this situation? What should it look like?
Yeah, first of all, solidarity is very important. You know, IMF and World Bank has given Kenyatta a lot of money, almost 100 billions of money to mitigate COVID crisis. And this money is not going to the ordinary poor people. First of all, you know, you have a very corrupt state and very predatory. So a lot of money is going to subsidize big companies that are associated with the ruling elite, especially flower industry. And it's very sad that this money come to subsidize these profit-making companies. Although they are calling that small and medium enterprises that will support them, but that's not happening. The money also was sent that they'll try to mitigate young people in the informal settlement. They'll clean up the bushes, the trenches, the sewage. That's what World Bank gave money. So one important international solidarity would want is to challenge this international institution of putting millions of people back to debt and poverty, but these resources are not accountable. They are not going to help people. The other international solidarity that is very critical is also writing and putting together a petition with the grassroots movement, especially the issue of debt. Because as we continue to pay debt, it's continuous robbing people basic needs like healthcare, education. Just imagine, Jeff, for millions of young people in Kenya, they are not back to school. They are just at home and they are not reading. Because of challenges, if they don't have food, they don't have even opportunity to read or continue with their school at home. So this is also another demand that the government and Solidarity International Network to push for a demand that the government democratize resources to reach ordinary poor people. So the other solidarity is the one that's very small, that fundraising we do just to support ordinary people through M-Pesa. That's what we are doing, and helping the human rights defender to move from one place to another, buying masks, sanitizer, things like that. Yeah, that's for survival, helping the frontline grassroots activists to continue raising the voices. That can also be an important solidarity. And you know, Jeff, you have done is trying to build also to connect the social justice movement with other global social justice movement. As you know, now we have 16 social justice centers in informal settlement, and we have 30 across the country. So we've been movement is growing, and soon we may convene our national conference if the COVID crisis permit, and then try to put voices together, and also use this situation we are facing to remind Kenyans that they are on their own, and we need to build a strong movement that can bring change. So that's another thing we are going to do, and also we will need a solidarity. And you ask also maybe because our prisons are also crowded. After this, maybe we'll start finding a lot of problem prison, and especially, you know, prison are disadvantaged people in the society. Majority of them are not remembered. Crisis of healthcare there will also continue affecting most of them. So as crisis unfold, that's another area we are going to watch out because it has been not given a limelight on what's happening there. Yeah, as I know, in Turkey and in our comrade
Estella.
Estella and our comrades in Turkey, they are from Turkish. They are finding a lot of problems. The Turkish regime is using prison to oppress and expose the great comrades who have been struggling against that fascist regime, to expose them to the disease, and it's horrible. And that's something that we can connect the struggles of people in that region, Rajova, the struggle that they are going through, and see how we can connect with that struggle. They have paid a heavy price for many years, so it's something also to learn to them, because I know during this crisis, how have they survived? Especially when the regime there in that region uses water, weaponized water against them, and It's the same struggle. It's the same
Yeah.
dehumanization people are facing the world. So I think also that kind of the struggle that we need to connect with.
Very good. Yeah. So, in terms of the struggle for at the Mathare Social Justice Center, then, do you have any kind of last reflections with respect to stories or something that you want people to know about what's happening on the ground? Anything in particular?
We need solidarity in everything that can amplify our voice.
Mm.
We need to work together. We need to unify our struggles. We need to think together. We need to build a collective platform for social justice. We need to rethink. And as you wrote an article from Rosa Luxemburg about rethinking now that the fascism is shaping up, we should not give in and unify our forces.
Any last words that you have for this? And we'll of course continue in conversation, but just in terms of a message that you want people to focus on with respect to what's happening in Mathare and how it's related to what's going on in other places.
What I can say that this corona COVID-19 crisis has put humanity in a crossroad. The humanity is on a trial. It's not only the poor people in Mathare, but our struggles will be connected all over the world. In every village in the world, everyone is struggling, from Brazil to Ecuador to there in the UK, here in Mathare, the struggle is real. So what we need to say is that we have to rethink about the future of humanity. Is whether we come together and redefine our humanity and know how to live together with Mother Earth, or else the future is very bleak.